Hi, I'm Dr. Joel Kreisberg.
And I'm Reggie Mara, and we're here to speak with you today about the importance of certification through the International Consortium for Health and Wellness Coaching. Recently, Dr. Kreisberg and our Director of Development and one of our teachers, Dina Salisi, have been certified. They've passed the certification exam by the consortium. And we want to just speak a little bit today about why they bothered doing that to begin with and what it means. So the first question that comes up for me, Joel, is so you've been a practitioner for decades. You've been coaching. You have a background as a chiropractor and a homeopath, and you've been serving a lot of people. Why bother with this certification?
Well, certification is really important to me. So that's why. Why is it important to me? I think that the work of the International Consortium for Health and Wellness Coaching has been to establish a level of competency that enables the profession, the clients, the public, the healthcare industry to actually, literally mandate that health coaching is a particular set of skills. And that if you're board certified, so now I can say I'm nationally board certified in health and wellness coach, just as Dina Salisi is. That means that we have had an external agency that sets a basic standard of competency certify us. We've gone through those hoops. And that's important because, I'm a big fan of certifications in general. I have a few of them. I'm a certified coach, just as you're a certified coach at the International Coach Federation. But health and wellness coaching is a specific field, right? And that's something that we wanted to make sure that we abide by those standards and we teach those standards. And so we want our students to be board certified as well.
Yeah, so more specifically, how does the certification the consortium is relatively new. It was conceived around 2015. It actually, I think the first exams were issued in 2017. You could sit for the exam in 2017. What impact does the existence of this certification exam and the consortium itself have on organizations like Teleosis Institute or anyone else who's actually teaching and offering health coaching courses?
Well, there's a bunch of different ones, and it's like I think it's early to see what the impact on the professional health coaches is going to be. I know at this point in time, there's 1,800 board certified health and wellness coaches. Okay, that's out there. They've given the exam 3 times. Okay, and so I would assume that the big impact would be that by let's say 2020, which stops being very far away, we're now in 2019, you will see more and more healthcare institutions like Kaiser and Sutter and all the big hospital systems really demanding that if you want to work for them, you be a board certified health and wellness coach. Okay, and that hasn't happened yet, but it's on the way. Part of the reason why that's likely to happen is because the International Consortium of Health and Wellness Coaching partnered with the National Board of Medical Examiners. That's the folks who licensed physicians to run this exam in this certifying body. And we have several of our colleagues to thank for that, Ruth Woolover and Karen Lawson, and Meg Jordan, to name just a few, but there's more than that. They realized that if we could make this partnership with the medical system, then the medical system will bring on that standard.
Yeah.
So it also kind of forced a lot of the schools to climb on board.
Yeah.
Right. And so I'm assuming that over the next couple of years, you will see the schools kind of fall out. Some of them will not maintain their certification as the standards go up. It also, which is where one of the things we're moving toward, is it requires continuing education. So we're saying in order to be a health coach, you need to maintain your education. And these days, Teleosis Institute's emphasis is moving more toward continuing education. Because narrative health coaching is actually, we've come to understand, is a more sophisticated tool in the health coaching industry than the baseline competencies.
Yeah. So if I'm someone who either is already a certified health coach, having passed the exam, or if I'm someone who's a coach who may not be that interested in certification, would the foundations of health coaching or I know the integrative the integrative health coaching clinic, would those be courses that would be of service to anybody who wasn't interested in certification?
Yes, well, so it's interesting because you said those are not interested in certification, but I think you mean those who might be already certified as a coach who may not want to be health coach certified, which is what you are. So half of our faculty is now board certified health and wellness coach, and half our faculty are just professional certified coaches.
Yeah.
Right. So if you're a professional certified coach, you may not want to be board certified health and wellness coach, but it still is that you may want some of those tools.
Right.
So the foundations class and the integrative health coaching clinic, which is the two classes that are currently available for continuing ed, what they are really, that's the sweet spot for these for students of the class. In other words, I think these classes are less designed for, I want to learn how to be a coach. And more designed for someone who is already has some basic skills as a coach. So your board certified health and wellness coach, or your ACC, which is Associate Certified Coach by the ICF. And now you want to deepen your skills.
Right.
You've likely learned behavioral coaching. That's the dominant central center of gravity in the health coaching industry, which is totally legitimate. And thank goodness we have behavioral coaches. You need that. And actually those jobs like Kaiser and so on really want you to be a skilled behavioral coach. Narrative health coaching uses a more sophisticated skill set, and I think you know about that, with the emphasis on stories matter.
Right.
And we can do all four of them, relationships engage. But the point is these are actually skill sets in which we now can actually ask our clients to not only make behavioral changes, but to sort of take a more holistic, integrative approach and do developmental change.
Right. So the combination, and I know that you and I agree on this, but I'll say it out loud anyway, is the either developmental or behavioral coaching can be effective depending on what a client needs, but combining the two of them, where both behavior and development are engaged, is an extraordinarily more effective approach to coaching.
Exactly. It's more engaging and it's more useful. And so our classes, the Foundations of Narrative Health Coaching class, is one where you take the skills, like you learn how to do SMART goals, and you actually put it in a context of a developmental approach, which says we want to not just get better behaviors or more skilled behaviors, we want to explore expanding our repertoire of behaviors in a lot of ways. So that's what the Foundations class does. And then, of course, the Integrative Health Coaching Clinic is, I still just don't see it on the marketplace. And it's amazing. We just finished a class, and there were, several students in there doing it for continuing ed, and they all say the same thing. It's like, this is a great way of being able to see a professional coach do the work, to learn some new skills, and to be amongst colleagues and actually study together. It's a wonderful environment where, I work with a client one-on-one on Zoom. You're probably watching, this is Zoom right now. And then we have a big conversation with students. And so it's just a lovely place to sort of, meet others and learn new skills.
Yeah, so great. So is there anything else you want to put on the table before we wrap this up with regard to the International Consortium and the importance of certification?
I think mainly it's like we want to make sure people understand that it's important to get certified. We recognize the value of certification. That's why our faculty is busy getting certified, and that we are committed to lifelong learning. And so, if it's something, if you want to learn some new skills, you want to add story, learning transforms and growth heals. Then, Telios Institute and our Foundations class and our clinic is something you should consider.
Great. Always good to speak with you.